नमस्कार दोस्तों, आई एम पूर्णिमा फ्रॉम फर्टिलिटी दोस्त। वेलकम टू येट अनदर सेशन। आई नो हम 5 बजे भी मिले थे और 6 बजे भी। तो चलिए अब कुछ अलग सी बात करेंगे। पिछले सेशन में हमने कुछ और बात की, अब हम बात करेंगे कुछ डिफरेंट हट के। इन दिस सेशन वील टॉक अबाउट मेल इनफर्टिलिटी। हम हमेशा भूल जाते हैं अपने पार्टनर के बारे में बात करना। वी जस्ट फोकस ऑन आवर हेल्थ इश्यूज, वी जस्ट फोकस ऑन आवर स्ट्रेस फैक्टर्स। हम बात करते हैं अपने पीरियड्स, अपने हॉर्मोन्स, और हमें लगता ही नहीं कि हमारे पार्टनर को भी शायद इन सब चीज़ों की, इन सब डिटेल्स की ज़रूरत होगी। सो ऐसा डिस्क्रिमिनेशन क्यों? लेट्स टॉक अबाउट आर पार्टनर्स ऑल्सो। आज हम बात करेंगे मेल इनफर्टिलिटी की। यूजली बहुत सारी चीज़ें हैं जो हम डिस्कस नहीं कर पाते। वी ओनली नो अबाउट दैट, ओके फाइन, काउंट इज नॉर्मल, मोटिलिटी इज गुड, दैट्स इट। और तो किसी चीज़ की हमें ज़रूरत ही नहीं है। ऐसा नहीं है। देर आर मैनी 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 थिंग्स। बहुत छोटी छोटी चीज़ें हैं जो हमें मेल इनफर्टिलिटी में ज़रूर बात करनी चाहिए, बट हम अक्सर भूल जाते हैं क्योंकि वी यूजली टेंड टू फोकस ईच एंड एवरीथिंग ऑन फीमेल काउंटर पार्ट। तो आज बात करते हैं मेल इनफर्टिलिटी, एंड फॉर दिस वी हैव वेरी नोन डॉक्टर फ्रॉम दिल्ली। सो दिल्ली एनसीआर पीपल जस्ट फोकस ऑन दिस सेशन। और अगर आपको हमारे डॉक्टर से मिलना हो देन ऑल्सो प्लीज लेट अस नो। व्यूअर्स, लेट्स स्टार्ट पोरिंग योर कमेंट्स रिलेटेड टू मेल इनफर्टिलिटी, और अगर इससे भी हट के कुछ सवाल हैं तो ज़रूर पूछिएगा। एंड थैंक यू शील फॉर दिस वंडरफुल सेशन। शील ने हमारे साथ बहुत अच्छे एजुकेटिव सेशंस किए हैं, एंड आर व्यूअर्स ऑलवेज अप्रिशिएटेड द डॉक्टर्स which have come forward to join our platform to educate our viewers. So viewers, let's start the session with our very known familiar doctor from Delhi. Namaskar, Dr. Vaishali, and welcome to Fertility Dost. Dr. Vaishali, you are on mute.
Am I audible now?
Yes, perfect. So viewers, today we have Dr. Vaishali with us, and जो हमारे regular viewers हैं उन्होंने डॉक्टर वैशाली के और भी प्रीवियस सेशंस अटेंड किए हैं हमारे साथ, एंड दे वाज जस्ट आस्किंग अबाउट कि डॉक्टर वैशाली को आप कब ला रहे हैं दोबारा सेशन पे. सो हियर्स वी हैव हर विद अस, एंड टुडे डॉक्टर वैशाली के साथ हम डिस्कस करेंगे मेल इनफर्टिलिटी के बारे में, मेल इनफर्टिलिटी एंड सॉल्यूशंस. Next week say we are celebrating the male infertility week, so we really want our viewers to know more about this sensitive topic, जिसको कि हम अक्सर अवॉइड कर देते हैं या हम डिस्कस करना ही नहीं चाहते. And Dr. Vaishali she is based on Delhi, and अगर Delhi NCR के लोगों को मिलना है तो please don't hesitate. She is senior gynec and IVF expert from VS Healthcare Delhi, and she has 3 times national award winners. So I can say that इतनी छोटी एज में इतने बड़े बड़े अवार्ड्स लेना बहुत कमाल की बात है. She got award for as budding IVF specialist, Hall of Fame laparoscopic surgeon, and most promising gynec. Dr. Vaishali has more than 12 years of experience. So viewers, please start pouring your questions. और अगर आपको लगता है आप इस पूरे प्लेटफॉर्म पे सवाल नहीं पूछ सकते तो प्लीज हमें मैसेज कीजिए. आई एम जस्ट फ्लैशिंग माय ऑफिशियल नंबर ऑन द मेन स्क्रीन, एंड आप वहां पे सवाल कीजिए और हम आपके सवालों के जवाब जरूर देंगे. सो ओवर टू यू डॉक्टर वैशाली विद आवर मेन टॉपिक, मेल इनफर्टिलिटी एंड सॉल्यूशंस.
Thanks a lot, Purnimaji, for such an elaborate introduction, and I am really delighted to have another session. I also got lots of responses after your last session. I really felt touched that I could be of some help in explaining such a sensitive topic like infertility is. We all know that it is definitely very difficult time for a couple when they face any difficulty in conceiving. So to discuss each and every aspect is really important, and I think male infertility is one topic which is most of the times untouched, and most of the people are unaware about it, and especially with all the male kind of environment in the family, they really don't want to talk about it. That is the perfect male nature. Whenever there is a problem, they just want to ignore it and avoid it, just don't think about it or talk about it, and last will be that they will come to us for any treatment. So I think that is this is a perfect platform where we can actually tell them that what is the major problem, where do we need to intervene, and actually it is treatable many a times. Most of them, they think, okay, something is wrong, we don't want to get treated, I don't know if there is any treatment, just avoid it, we don't need anything. It's not like that. We have nowadays treatment options are there, so it will be really good that we are able to discuss this important topic on we are having the next week is dedicated for the male health, and I think this one part about male health is also very untouched, and it should definitely people should become aware about it. So I
Right.
think if we can share the slide, we can definitely start our session.
Yes, yes, sure. Yes.
So coming to the male infertility, we all know the male factor is solely responsible for infertility in 20% of the cases. Many a times we have seen that every time whenever there's any difficulty in conceiving, people are hello Purnima ji, am I audible? I am unable to see you.
नहीं नहीं, यू आर ऑडिबल. मैं थोड़ा
Okay.
मेन स्क्रीन से हट गई थी. प्लीज कंटिन्यू प्लीज.
Yeah. So, see, males, if we see, males are solely responsible for any problem in conceiving in 20% of the cases. It's not like that only female is responsible if pregnancy is not happening. And if we see, males are contributing to infertility in another 30 to 40% of the cases. There may be something wrong with the female partner. But majority of the times when there is something wrong is found out in the female partner, nobody is bothered to find out what is the semen parameter or what is happening there. So I would say 30 to 40% of the infertility cases, male partner is also contributing. So it should never be missed. We should always try to find out what is the obviously semen analysis is the cornerstone where we are finding out the counts of the sperms, the motility, the morphology, and many other things. And also, I would like to bring this thing into notice that many a times the sperm count may be normal. The counts may be there, motility may also be there, many other things may also be there. But even then, the sperms are not able to function in a manner which is necessary for fertility, and it can still cause infertility. So that thing is not measurable in the normal analysis that we are usually doing. That thing has to be considered whenever we find that okay, there is something wrong and pregnancy is not occurring. If we look at the Indian burden of male infertility, in India, almost 7% of all the men they have some or the other issue with the semen parameters or some other problem in conceiving. If we see 35%, only 35% have normal sperm parameters in India. Rest of them they have one or the other problem. It can be decreased sperm count as seen in another 35%. There can be actinoteratozoospermia, which means the sperm count is there. So the sperms are there, but they are not able to move. That thing is called as actinoteratozoospermia, which is present in 20% of the patients almost. And then another most dreaded thing which every male is most worried about, that is azoospermia. That is present in 10% of the people. In this, there is no sperm at all in the semen analysis. It is also called a zero sperm count. So whenever a report comes with a zero sperm count, it is actually very dreadful for the couple, especially for the male partner. They are not able to come to the terms that okay, something like this can be problem can exist. So for that, I really want to bring this thing into their knowledge that zero sperm count is not the final verdict. Whenever there is a report which says there is no sperms in this thing, we have to repeat the semen analysis at least after 1 month or 2 months. Only one report showing no sperm doesn't mean anything serious. So always get a repeat semen analysis done. And even then, if there is no sperm count, then it doesn't mean that sperms are not getting formed inside. There is a probability that sperms are getting formed inside. They are not able to come outside in the semen. The way tubes get blocked in females, similarly tubes can get blocked in males also. That tube is called vas deferens. Vas deferens is the tubing which brings out the sperms which are produced in the testis to the outside into the semen. So if that tube gets blocked due to any reason, due to infection or due to any previous surgery, due to anything, then the sperm production will be there, but it will not be able will be visible in the semen. So that is one reason for the infertility. And in such cases, IVF is a very good solution. First thing is we find out what is the cause, why the sperms are not there. And if these are being produced inside, then definitely there are surgeries which can try to open that tubing, which can try to make anastomosis in that tubing, and that can also be successful. Otherwise, IVF with ICSI is definitely very successful in such cases. If we look at the risk factors of the male infertility, then obviously everybody knows this: cigarettes, tobacco, marijuana, smoke, all these things are obviously toxins and they have a very negative effect on the sperms also. As such, they are causing damage to the body also, but because sperms are small cells which are just getting divided, they are in action actually. So when any cell is getting division is there, that cell is most sensitive for any toxin. So, whenever any person is taking cigarettes or tobacco or any kind of addiction, all those things they have the maximum effect or maximum hazard on the sperm production. Similarly, it is absolutely true for the females also. Because in their ovaries, cells are getting divided, cells are getting, eggs are getting formed. So, because these are in division, the work is going on there. So, any toxin will cause major effect on that part. It is not it will affect lungs, but it will happen later on. It will also affect your liver. It will happen later on. It will take many years to have its effect. But cigarettes, tobacco, alcohol, all these things will have immediate effect on these cells because these cells are actually in work. They are doing, they are dividing, so they are requiring everything. So when they are taking out the requirement what they need, they will get toxins also. So that is the reason why the major effect of these things they happen. Whenever we are getting a patient of infertility, we always ask them avoid smoking, avoid taking alcohol till the time pregnancy is happening, at least because it will start getting giving us results. This compound may improve within 3 months. We will get a good result. So, and for males specifically, hot water baths for a very long time every day is detrimental because we all know sperms they need a colder environment for development. That is the reason why the testis is outside the body. It's not inside the way ovaries are inside the body. Sperms they need a colder environment. That is why sperms are these are produced outside these are kept outside the body. And if a person is taking a very hot water bath daily for a very long time, it will have a very negative effect on sperm production. But the good thing is that all these things are reversible to an extent because sperm production is an ongoing process. It keeps on dividing. Every 3 months there is a new batch of sperms. So whatever a person will make changes in the lifestyle, he will get definitely get a good response in another 3 months at least. So similarly, if there is any previous history of cervical this thing for vast difference, there is any inguinal hernia history, surgery, then all these things are the risk factors which predispose a person for male infertility later on. Similarly, causes, if we look at the causes of decreased sperm production, there are chromosomal genetic problems which they may run in the family. Many times a person comes to us who can say that, yeah, his uncle had the similar problem, his brother also had a similar problem. So many times it is related to genetics. That is why we always get a genetic testing done whenever there is a zero sperm count or too much abnormal sperms are there because it can be transmitted in the sun also. So that is why this genetic testing is needed. Because if a person has a severe abnormality in the semen, And he is carrying a chromosomal problem, it can be transmitted to the baby if the baby is going to be a son. So it is always tested so that this thing can be prevented. Similarly, any person who has history of infections or if he has history of multiple sexual partners beforehand, all these things predispose for blockage of the tubings of the vas deferens, which can lead to zero sperm count. Similarly, torsion in case there is this is a thing where there is severe pain in the testis, it can occur rarely. Then also there is some damage to the testis which can lead to decreased sperm production. Then there are other diseases where we get the ultrasound done. Whenever there is some abnormality in the semen, we get an ultrasound done for testis, both the sides, so that we get to know if there is some other abnormality associated which is leading to problem in the sperm production, like varicocele. Varicocele is dilated veins which are present in the testis, which in turn are increasing the temperature of the testis inside. So as such, because of that increased temperature, again the sperm production goes down. So this has to be surgically treated if it is there, a major part is there. Similarly, other things are also can be seen in the ultrasound like hydrocele. That thing will not cause any major problem. So we have to get the ultrasound done for the testis to find out if anything major reason for the decreased production of compound is there. Then next comes the medicines. Medicines are also responsible for the problems because like if some person is taking any medicine for any psychiatric issue or because all these things they cause changes in the hormones, they can increase prolactin levels, so these will in turn need to decrease in the sperm production. So whenever there is any problem in the semen parameters, we always ask them are they on any treatment or were they on any treatment, because if they are then they need to taper it down slowly so that the effect will wean off in another 3-4 months. This way sperm count can come back to normal. Similarly, radiation damage also causes decrease in the production of sperm. That is the reason why whenever a person, a young male, is detected with any tumor in the testis or something, we always ask them कि before going ahead for any chemotherapy or radiotherapy for the tumor in the testis, go for semen freezing. Because semen freezing is a very simple thing. It can be done very easily. They can go to any center and the semen can be kept frozen for many years once it is done. And they can give multiple samples in a month, within a week or within a month. And then they can go ahead for their treatment of radiation. Because after radiation, the sperm production will not be there. And in that case, if they want to go ahead with the fertility, they will have to go ahead for a donor semen. So, if this awareness is there in the general public, that if some tumor comes out to be positive in the testis, don't go for radiation immediately. First, go for semen freezing, which is a very simple process, and so that you can avail your fertility chances later on in life whenever you want. So this is a very simple thing, but many of the people are not aware about it. They come to us when they are facing difficulty, and then they tell us, "Okay, yeah, I got radiation because of this tumor. I had it." So we have to give them donor semen at that time. So these are the things. Then yeah, blocked sperm transport we already talked about. Like the way if that tubing is blocked, then the sperm will not come out. Are getting from inside, but they are not present in the semen. So in this cases again the causes are infections or any previous history or genetically also these tubings can be absent in these, or if any person has undergone a surgery for the vasectomy and then they want to get it open, it can also be done. But if it is not possible, IVF is the final resort and it is very successful in such cases when this tubing is blocked. Similarly, when tubes are blocked in females, again IVF is very successful because you are just bypassing the thing what was is missing naturally. So we get a very good result whenever there is any blockage in the tube or any blockage in the vas deferens in the males. So if we look at the sperm, the things which are causing damage to the sperm, we know poor diet obviously. Increased BMI has a very detrimental effect on all the organs of the body. Similarly, it is affecting the sperm production. Then smoking, caffeine, too much of coffee also is not very good. Alcohol, stress, and also infrequent ejaculation. If somebody is not very active and they are having infrequent ejaculation, then also there can be damaged sperms in the semen. That is why whenever we ask somebody to give a semen sample, we always ask them to give a semen sample after an abstinence of 3 to 5 days. It should not be
Hmm.
less than 3 days also, and it should not be more than 5 days also. Because if it is longer duration, then again the sperms are not that good. So the report may be false. It may not be the actual true report. So infrequent ejaculation is also one of the reasons. Then high temperature, as we already discussed, so if somebody is having frequent saunas or hot water baths, then this is also not very good for sperm growth. Aging, again, aging is not very much effective or very much detrimental in males. Aging is more problematic for females because eggs they deteriorate in their quality with age very steeply after the age of 35. Then pollution, toxins, radiation, already we all know this. So varicocele we have already discussed is veins which are present around testes which can be detected by ultrasound testes. Then infections, obviously. So all these things they have negative effect on the growth of the sperms, and they can finally cause some DNA damage also. It's not that if they are causing decrease in the counts, that is one thing. If they are causing decrease in the motility, that is also one thing. But many a times all if all these things are not very extreme, then they may not cause any major decrease in the count or motility, but they may cause damage in the DNA. That is also one major reason of infertility. Many a time this thing gets missed because counts are normal, motility is normal. So many people say think semen report is normal, so the male partner is not responsible. But when we do an IVF, then we get to know the sperms are looking normal, but they are not able to fertilize. We are trying to make embryos. They are not able to fertilize. They are not able to grow. Embryos are not growing. They are getting arrested. The growth is getting arrested. That thing happens because there is damage in the DNA of the sperms, and all these things can cause this thing. So that definitely whenever a couple starts to plan a pregnancy, they should abstain from smoking, alcohol, and any kind of addiction, and they should start abstaining at least 6 months prior to this. It's not like that you want to conceive next month and you will do it right this month. It's not like that. Always plan it beforehand and start abstaining at least 6 months before you start planning a pregnancy. So, and there are again the hormonal issues are majorly missed in males because males we always test all the hormones in the females. Males are never getting tested for any hormone, and when you look at their thyroid levels, they are like hypothyroid and they are shooting like anything, and you are just treating the female partner. So all these hormones are equally important for males also. If the thyroid hormone is high, we need to give them medicine for that. If their prolactin is high, we need to give medicine for that. Again, FSH, LH, if they are very low, we need to give them injections for FSH and LH. Again, if the estradiol is high or testosterone is low, in that situation also we need to give them some medication to counterbalance these hormones so that the quality of the sperms which are being produced, these are good. Good enough to fertilize, good enough for the embryo to grow, and so that the whole pregnancy can continue till 9 months. Many times, what happens, a person is able to conceive, but then the miscarriage happens. Nobody knows why did the miscarriage occur. So all these things are in the before are in the backstage for that because the sperms were having DNA damage or the hormonal things were not right. Then the embryo which is formed, it is not 100% healthy. So it will have the that pregnancy will end up in a miscarriage. So all these things are actually very important. Similarly, we can look for the infections. Many a times, when only semen analysis is done, semen culture is not done. So we usually look for pus cells in the semen analysis, and if pus cells are there in this semen, then we always ask them to get a culture done. And if culture comes out to be positive, we give them antibiotic according to the culture sensitivity. And even if the culture is negative, I would say we always try to give them antibiotics because pus cells are there. That is showing that there is some kind of inflammation is there. So we always give them an antibiotic course which helps in normalizing this part of the semen. So this is the zero sperm count we have already discussed when the sperm production is normal but the sperm count is zero. So in that situation, this is called as obstructive azoospermia. That there is some obstruction That is the reason why sperms are not coming out. In such cases, when we do an ultrasound, we see a normal size testis, we see a normal FSH, we see normal testicular biopsy report is there. So in all these conditions, we get to see that everything is normal, but only thing is there is no sperm in the same. So that means sperms are there inside. We can take them out and we can use them for IVF cycle. So such couples, pregnancy is possible with their own sperms and without any major side effect or anything. If we come to the nutrition or the diet, we all know various micronutrients are associated with male infertility. Many times the diet, if it is not sufficient, it is not containing all the micronutrients, then deficiency of these micronutrients may result in infertility. If we look at the molecules which are specifically important for male fertility are L-carnitine, coenzyme Q10, zinc, arginine, vitamin B12, lycopene, vitamin C, vitamin E, then glutathione, selenium. All these are actually very important. These are present in dry fruits and fruits. Many vegetables they are specific for these things. I'll be giving a list I think later on. And all we have medicines also for these. Many people are vegetarians; they are not able to take non-vegetarian diet. So some of these things they get missed in their diet. That is also one of the reasons why the sperm semen count may not be that good, or the sperm quality may not be that good. So in such cases, we have tablets. These in the form of tablets, they can take those medicines, and they have to be taken at least for 3 months so that they can have a whole effect on the production of sperm. So these are the multivitamins which are important. And if we look at the specific food which are good for male fertility, there are Brazil nuts, cottage cheese, broccoli, mushrooms, eggs, fish, sardines. All these are very good for the male fertility. And these they contain both the vegetarian and non-vegetarian options. Similarly, I could say a balanced diet with a dietary supplement containing all those multivitamins and adequate hydration. All these things are actually important for male fertility because if adequate hydration is not there, then what happens? The semen it becomes a bit kind of thick. The hydration is not there, body is already deprived with water, so the semen will be very thick. The sperms may be stuck in kind of a situation, gel kind of a situation, so the sperms are not free to fertilize the egg. That is why hydration is very important for males also. Other thing is, whenever they are taking alcohol or even if they are taking just beer, that thing is also making your body dehydrated. Everybody knows that alcohol causes dehydration. But how is it impacting the sperm growth? Because the whole semen becomes dehydrated. It doesn't have an environment where sperms can actually swim. So sperms are not available for fertilization. So these things that is the reason why these things are so much detrimental. They are causing DNA damage also and they are also making the environment not very good for the sperms to basically swim and fertilize the egg. So hydration is actually really very important. Then there is one more thing that is called as Oates syndrome, or we call it as Oates. Oates means oligospermia, asthenozoospermia, and teratozoospermia. It is a kind of severe vein infertility. There is problem in everything. There is sperms are less. They are not even moving, and whatever sperms are there, they are not looking normal. So when all these things are there, I would say don't waste your time. It's not an option to go for IUI in such a situation. Better to go with IVF and ICSI in such cases. It is more cost effective. It is more beneficial. If the report is coming as oats, then don't take it too lightly. No, I will try later on. I will see. No, it's not like that. It is actually a major kind of a male infertility. The counts are less than 5 million. Morphology is less than 2.5%. Motility is less than 10%. So if all these things are present in this, then definitely better to go ahead with IVF and get the ICSI done so that you will have a better positive result. Similarly, I already talked about DNA fragmentation, DNA damage. It is caused by many toxins, as we have already talked about, and it is one of the most common causes of poor sperm health. And many times it is not known; it goes undetected many times because it is not notified in the normal semen analysis that is normally done. For this, we have to do a separate testing. And if DNA fragmentation is there, it is more than 30-35%, then we have to anyhow ask you to change your lifestyle, give you some multivitamins which have proven to improve the DNA fragmentation, which has already occurred due to your lifestyle or something. So all the whole list of multivitamins that I showed you earlier, those things they actually help in improving it. DNA fragmentation has a very major negative effect on pregnancy as such. It reduces the fertilization rates, it reduces the embryo quality, it decreases the pregnancy rates, and there is very high risk of miscarriage also, as we already discussed. So there is very high incidence of diseases also in the baby if there is DNA damage in the sperm. So these are the things we have. These are the causes or these are the problems that we have. And if we discuss the treatment options that we have with IVF, we are doing ICSI. We also have the option of going for PICSI or MAX or MC. All these are advanced technologies which are you trying to find out, select the most suitable sperm or most efficient sperm for fertilization, so that whenever an embryo is getting formed with these sperms, the embryo is healthy. It has the potency to grow. It has the potency to continue till 9 months of pregnancy, and the baby who is formed is healthy. So we have so many treatment options nowadays which help us in selecting that kind of a sperm, even if the overall quality of the semen is not that good. So I think I tried to summarize it in a nutshell this time, and we can take the questions now if you really want.
Right. So thank you, Dr. Vishali. I think that slides explain more than words. We can say that. So let's have few queries. First of all, मतलब बहुत लोगों ने यही पोस्ट किया है कि what exactly is the role of antioxidant. Usually when we have male factors, तो डॉक्टर सबसे पहले बोलते हैं कि आप 3 months तक एंटीऑक्सीडेंट्स खाइए, बट पीपल यूजली से इसकी क्या ज़रूरत है और इसका कितना फ़ायदा होगा. सो एंटीऑक्सीडेंट्स एंड मेल इनफर्टिलिटी.
Yeah, as I already tried to explain it, the role of antioxidants, it actually corrects the DNA fragmentation which has happened due to either the addictions or due to lifestyle changes, due to stress, or due to any reason. If there is something wrong with the DNA in the sperm, then these antioxidants they reduces the oxidative stress, and it helps in improving the quality of the sperms, and it helps in improving the potency of the sperm, that sperm can actually fertilize an egg, and it can actually make an embryo which has the potency to grow into a healthy baby. So antioxidants are really very important. That is the reason we are always writing them and asking them to please take it, because we all know the diet that we are all are taking nowadays is not that accomplished with the nutrients that it used to be. In the earlier
Right.
days when we all were living in the rural areas, we used to have fresh vegetables. Nowadays we don't have any fresh vegetables. So all the whole list of molecules or the vitamins that I listed, all are normally present in the diet, but we are not getting that kind of a diet nowadays. And also nowadays there are so many toxins, alcohol, smoking, tobacco, marijuana, whatever kind of addiction is there. All these things are causing damage to the DNA, and these antioxidants they actually help in that. And even if your semen count is normal, even then we give you antioxidant just to correct this DNA, which may not be evident right now, but at molecular level it can exist, and it will hamper your chances of having good pregnancy. So if whenever there is any difficulty in conception, we always advise it. And anyhow, these are multivitamins, no harm in taking antioxidants.
Right. Next time, if your doctor is suggesting or prescribing you antioxidants, please उसको ले लीजिए. ये मत सोचिए कि कुछ नुकसान है, वो आपको फायदा ही करेगा. Dr. Vishali, one query we have from our member. बहुत मुश्किल वर्ड है, होपफुली आप पढ़ लीजिए. व्हाट इज और लाइक वो जो भी है इन मेल फॉर इनफर्टिलिटी.
This is exactly the same thing I described it. In short, it is called as oats, oligo, and serum,
Okay. Okay.
teratospermia. So this is the oats that I described in my last slide, I suppose. This is a
Mm-hmm.
major male infertility this thing, because in this oligo means the number of the count is also low. Estino
Hmm.
means the sperm whatever are there, they are not able to move. And terato means whatever sperms are there, they are not looking normal. So
Okay.
all these things are present there in the semen. So the sperms are
Hmm.
there, but whatever they are lesser in number. They are not mobile enough to go and fertilize an egg, and they are not normal enough that they will make a good embryo or healthy embryo.
Right. Right.
So
Right. Right.
this kind of report is usually given only when we do it in a very good center, because we need a very good microscope for this. You will never get this kind of a report in a low or
Yeah.
a lab which is not very accustomed, or which has this kind of apparatus to look into this one, because they don't have the microscope, so they will not be able to have a look at this one. Many times it is always, if this is there is a myth that many patients also feel, when I got it done from my hometown, the report was absolutely fine. Now when
Mm-hmm.
I'm getting it done from an IVF center, they are showing that you have this problem. It's not like that they are making it up, because they have a good microscope, they can see it, and they are telling you this thing.
Right, right. Doctor, this case, particularly in this case, according to you, what is the option now? Is IVF is the only option?
I would say first, anyhow, we always ask them to take antioxidants to make changes in their lifestyle, and we can see it for another 3 months. They can take all these medicines for 3 months, and we also keep a semen sample frozen for future. By chance, if the semen gets deteriorated with time or
Hmm.
something, we have one backup with us. So we always do that. We always keep a sample frozen with us, and we are giving you a medicine to be taken, antioxidants, all the multivitamins, and we ask you to bring your BMI down if it is very high. We always ask you to be a more active, and to make changes in your lifestyle, make changes in your diet. With all these things done for 3 months or more, if we feel it is not happening, any major change is not occurring, then IVF is the final resort. Then there is no doubt. Okay.
Okay.
But
Right.
in those 3 months, they can definitely go and try for a pregnancy while on the antioxidants, so that if the pregnancy
Hmm.
can occur, it will definitely occur.
Right, understood. So, if you are in the session, so please take a note. And obviously, you are in Delhi NCR area, so definitely please meet the doctor and let me know whenever you want an appointment with the doctor. Let me take. I'll just take another query. Sorry, आई थिंक इस अब तक का सबसे मुश्किल वर्ड था जो मुझसे पढ़ा ही नहीं गया. So, do we have any medicine for genetic issue in karyotype of husband?
See, there is no medicine for correcting the genetic issue. Genetic means it is there in the chromosome. But what we can do, we can find out if it is getting transmitted to the baby or not. And when we are making embryos, we can
Hmm.
sort out the embryos, do the PGS, we can do the genetic testing in the embryos, and find out if that genetic issue that your husband is having is
Hmm.
getting transmitted or not. And we will select only those embryos which are not having those genetic issues, so that only those embryos with normal genetic material can be transmitted, and you will have a perfectly healthy baby.
Right. So we can say that IVF is the only option for you because we really need PGA tested embryos.
Absolutely, absolutely.
Okay. Uh, so, uh, just a second. Doctor, we have one more query related to this chromosomal thing. क्या ऐसा हो सकता है कि पहले जब आईवीएफ करवाया और एम्ब्रियोज टेस्टिंग के लिए भेजे तो उनमें क्रोमोसोमल इश्यूज थे और 2-3 साल बाद दोबारा आईवीएफ करवाया और क्रोमोसोमल पीजीएस टेस्टिंग करवाई एम्ब्रियोज की, तो वो सब ठीक थे. इज इट पॉसिबल?
या एब्सोल्युटली पॉसिबल,
ओके.
एब्सोल्युटली. जेनेटिक मटेरियल है वो. जब आपका एम्ब्रियो बन रहा है, when the sperm is getting fertilizing the egg, the material which is getting formed at that time will depend upon what is the DNA damage in the sperm at that time. If the
राइट.
sperm was damaged at that time, the embryo which it will form at that time will be not genetically right. So we will have to see what kind of genetic abnormality we are talking about. There are some abrasions or some genetic problems which are called balance translocations.
हम्म.
Some things are there which will always be there. Okay, some genetic problems. But there are certain genetic problems which may or may not recur. That is why we always do the PGS in all the embryos, because we are just hoping that there we will find some embryos which will have no problem at all, and we will use them for implantation.
Understood. So, I think this cleared your doubt regarding कि अब तो कुछ problem नहीं आया, पहले आया था. So it may happen, and you should be happy that your embryos are really good. Go ahead with embryo transfer, and we really hope that motherhood is on the way for you. Dr. Vishali, usually people says कि बहुत issues हैं. What I can say is nil count. So what about that? क्या
Yeah.
उसको हम ठीक कर सकते हैं? क्या उस केसेस में सिर्फ आईवीएफ ही ऑप्शंस है? ऐसे लोगों के लिए नेचुरल कंसेप्शन ऑप्शन है ही नहीं.
See, we have to find out what is the cause of nil count. We already discussed. If there is some obstruction in the tube, that is the reason for nil count, then we have to correct that obstruction. There is a surgery which usually urologists or surgeons they do. So if it is
हम्म.
possible, if the obstruction is not that bad, they may correct it and then it can work. Another reason for nil count is there is some hormonal imbalance. Okay, the sperms are not getting produced because of high thyroid levels or high prolactins or due to some medicines which the person is on at that time, which is inhibiting the production of his sperms. So all these things can lead to nil count. So we have to first find out what is the cause of nil count. There is a one thing called hypogonadotropic hypogonadism, which means body is not having all those hormones like FSH, which will
हम्म.
make the testes form sperms. So in that case, if that person is deficient in those hormones, then definitely there will not be any sperm. And when we will give them the injections of those hormones, the body will start forming the sperms. So we have to find out what is the cause behind the nil sperms, and then on the basis of that, first we correct it, and depending on the result, if it gets corrected, then no IVF is needed at all.
बिल्कुल राइट. एंड सो नेक्स्ट टाइम अगर आप अपना हार्मोन टेस्ट करवा रहे हैं तो प्लीज ये मत सोचिए कि आप अपने पार्टनर का नहीं करवा सकते. यूजुअली वी सेज कि सारे टेस्ट मेरे साथ ही क्यों. So
Yeah,
you can together go for hormonal test, right?
yeah, definitely.
सो यूजली ये मानना है डॉक्टर वैशाली के मेल्स में या तो कोई इश्यूज प्रॉब्लम्स होते नहीं हैं. होते हैं तो विद इन 3 months we can easily rectify that or we can deal with that. Solutions are there. Is it really so that this 3 months of period is important for any kind of treatment with male medical issues?
Yeah, majority of the times, yeah, it is. Why? Because the life cycle of a sperm, it is 3 months.
Hmm.
One
Okay.
sperm, yeah, that is the reason why everything is given for 3 months. The body is taking 3 months to form a sperm. So whatever changes you are making in the lifestyle right now, the result you are going to get after 3 months. Because the sperm which will start forming right now in the body will come out after 3 months.
Okay,
So
understood.
you will start making those things, you will get a result in 3 to 6 months. Absolutely.
Okay, so if your doctor is advising 3 months of any antioxidant course or any kind of lifestyle changes, be mindful that these 3 months are really important. And Dr. Vishali, there's very hype about DFI nowadays. या तो हम पहले बात नहीं करते थे या हमें पता नहीं था, कुछ भी रीजन था, बट आजकल जब भी हम एक सीमन एनालिसिस देखते हैं, रिपोर्ट देखते हैं, तो एक फट से सवाल आता है, काउंट, मोटिलिटी एंड नेक्स्ट इज DFI. सो क्या ये वैसे ही कॉमन हो गया है, या ये DFI जो हमारा DNA फ्रेगमेंटेशन का इश्यूज है, ये बहुत ज्यादा बढ़ गए हैं या हम अवेयर हो चुके हैं? व्हाट कुड बी द रीजन फॉर दिस?
आई वुड फील कि ये सीरियसली बढ़ गए हैं.
ओके.
Really, yeah. Earlier the major problem was zero count. ऐसा नहीं होता था कि sperms है, सब कुछ है, even then the pregnancy is not occurring. Nowadays
राइट.
it has increased, and the reason again are the whole list which I already discussed: the whole addiction, smoking, alcohol, tobacco, stress, pollution, toxins, deficiency in the nutrition in the diet, the lifestyle. So all these things are responsible for this. DFI has definitely increased in males because of all these changes. And that is the reason. Earlier, the only problem which was used to be found in males was sperms नहीं है. That is the reason why pregnancy is not occurring. अभी क्या
राइट.
होता है, सब कुछ होता है, फिर भी pregnancy नहीं होती है.
नहीं होता.
Similarly, is in the females also. Earlier, when I started my career almost 10-12 years back, the major cause of infertility in India was blocked tubes. That was due to tuberculosis. My
राइट.
thesis was also done on tuberculosis only. So tubal blockage was the major reason because India में TB इतना common होता था, tube block हो जाती थी, pregnancy नहीं होती थी. And IVF was a very good solution for that because you are bypassing the tubal usage. जो आपको tube में करना है fertilization, वो वहाँ नहीं हो पा रहा है. You are doing it in the lab and then putting in
राइट.
the amp. So success rate भी ठीक है. Everything is good. Even nowadays, when the technology has advanced so much in the IVF, block tubes के लिए whenever we are doing IVF, the results are very good. I would say IVF cycle getting done for block tube only without any other reason, success rate is almost 80%. जबकि जनरल उसमें आप जब एवरेज निकालते हैं सक्सेस रेट ऑफ आईवीएफ इज ओनली 40%. Hardly
40%.
40%, 30%, 40%. But that is because of the other factors. When the only sole reason is the block tube, then success rate is actually good nowadays. But what happened over a period of time, IVF की technology तो इतनी अच्छी improve हो गई, but even then success rate is not increasing because
राइट.
अब block tubes की वजह के बजाय the cause nowadays has become unexplained infertility. Unexplained
बिल्कुल.
का reason means अब everything is there. egg बन रहा है, अल्ट्रासाउंड में दिख रहा है, रिलीज हो रहा है, sperm भी है, सब कुछ हो रहा है, pregnancy नहीं हो रही. And what I have seen, when we do an IVF, then we get to know. When we take out those eggs outside, then we see that these are not normal looking eggs. They are getting damaged by all these alcohol, smoking,
We can say.
all that. Then
राइट.
stress, then weight gain, high BMI, obesity. All these things they cause the damage. Similar damage is done in the sperms that is calculated as DFI. So if DFI is high, that means the sperm is there, but it is not able to work. It is not. It doesn't have the capacity to fertilize. Then how do I
बिल्कुल.
expect कि वो pregnancy में convert होगा? और होगा भी तो miscarriage के chances will be there. It will be higher.
राइट.
So these things they have become more common only because of the changes in the lifestyle and our environment. Those are the things.
राइट. एंड व्हाट अबाउट द फीमेल फैक्टर? लोग पूछ रहे हैं कि अगर 3 महीने मेल को काम करना है, तो फॉर फीमेल ऑल्सो 3 months इज इनफ टू वर्क ऑन बॉडी पैरामीटर्स?
See, for 3 months, I would say for female will be good if they have a high BMI. If they have actually they need to reduce the weight, then 3 months is really good. You can reduce weight in 3 months. For female, eggs का कोई रोल नहीं है उसमें. Eggs जितने बॉडी में होते हैं वो उतने ही होते
उतने.
हैं. Yeah, you can take antioxidant, they will help you. But हाँ, recruitment होता है enteral follicle count का, जो हम बोलते हैं जो small eggs which are visible in the ovary at the start of a cycle. That recruitment takes 3 months kind of a thing. So yeah, for females also, whenever we give something antioxidant to male for 3 months, we always give them for 3 months this also. बट फीमेल्स में कोई प्रोडक्शन नहीं हो रहा है कि वो एकदम से ड्रास्टिकली हेल्प कर देगा.
होगा, राइट।
Yeah, but it will help in improving the number of interfollicle counts, and also you can utilize it doing your general well-being, because overall the body, the environment is important for pregnancy. Many a times we have seen when a person is too much stressed for pregnancy, फिर आप चाहे IVF कर लो, कुछ भी कर लो, pregnancy नहीं होगी.
नहीं होगा,
You have to be
बिल्कुल।
relaxed first. That is the most important thing. So utilize those 3 months in doing yoga, meditation, exercise, reduce your body weight. That is the most important.
राइट। एंड अगर आप सच में मानते हैं कि यस, यू नीड टू visit fertility doctor and your doctor is advising some kind of advanced treatment for your pregnancy, then just stick to this 3 months guidelines. It will definitely going to help you. Do these little things, lifestyle modifications, yoga, meditation, exercise is really important. Work on your diet parameters, they will really help you. And yes, sleep patterns, stress, सब पे काम कीजिए, और 3 months के बाद you both can definitely again revisit the doctor, and doctor will say yes, we are ready to start the procedure. And if you are really thinking of joining any of yoga meditation sessions, please let us know. Our official number is flashing on the main screen. We have many interesting sessions for you. And this month, we are organizing full 7 days a week free yoga sessions. So, Dr. Vaishali, it's always a pleasure to have you on the main screen with me. So, thank you so much for joining today. हमने बहुत सारी बातें ऐसी की जो शायद लोग सोचते थे ज़रूरी भी नहीं है. But yes, these simple, small, little talks are really important. And मैं आप सबको ये एडवाइस करूंगी कि आप ये सेशन अपने पार्टनर को ज़रूर दिखाइए. फ्राइडे नाइट को हम बहुत सारी सीरीज देखते हैं, तो आज ये सेशन को रिविजिट कीजिए. हो सकता है आपको कुछ पॉइंटर्स ऐसे मिल जाएं जो कहीं ना कहीं आप मिस कर रहे हैं. वी आर नॉट सजेस्टिंग कि आपको कुछ इश्यूज हैं, आपके रिप्रोडक्टिव सिस्टम में प्रॉब्लम है, बट वी आर जस्ट सजेस्टिंग कि एक बार देखिए तो सही, कहीं कुछ मिस तो नहीं हो रहा. एंड अगर हो रहा है तो प्लीज डू स्टार्ट वर्किंग ऑन दैट. We really want you to achieve your parenthood as early as possible. And thank you, Dr. Vaishali. Once again, thank you, Sheel, for arranging this beautiful session. Thank you, ma'am. We love to have you again on our session.
Yeah, anytime. Thanks a lot. This topic is really very close to my heart, and I really love talking about it and making people aware. Ki, yeah, please know this and do this. Thank you. Thanks a lot.
Thank you, ma'am. Thank you. Bye bye.
Bye. Take care.